This is nasogastric tube removal. The physician has ordered that my patient have their nasogastric tube discontinued. When on entering the patient's room, I'm going to assess and make sure I have the correct patient by checking the name badge, having the patient repeat their name and date of birth. Next, I'm going to explain the procedure that I'm about to perform. Any questions or patient teaching would be appropriate at this point. Next, before I begin anything, I need to assess the patient's bowel sounds. And before doing that, I also need to turn off the suction. And then I need to be sure, before I discontinue this, that we have active bowel sounds in all 4 quadrants. Patient has active bowel sounds, so we will continue removal. We have the suctioning already turned off. We just need to discontinue it from the nasogastric tube. And then we need to flush the tube with 20 cc's of fluid and 20 cc's of air. We want it to be facing downward so that so that water is being flushed through first, which is going to flush out anything leaking in the esophagus when the tube is pulled out, along with the air that pushes the tube away from the stomach lining and reduces risk of trauma. After this is inserted, you can leave this here. We're going to remove the tape. I'm going to ask the patient to take a deep breath and hold their breath until I pull hand over hand over hand. So it comes out and everything's intact. Clean up. And then I want to do oral cares, mouth oral cares, to remove anything that followed the tube up the esophagus. And then I need to assess my patient every 2 hours for signs of nausea and vomiting and abdominal distension, and for bowel sounds. We need to have active bowel sounds. And then documentation.